Hi, I'm Joe Feeks, editor of Pig Health Today, and with me is Dr. Emily Byers. She's a swine veterinarian at Prestage Farms in North Carolina. Good to see you again.
You too. Thanks for having me.
You bet. About 18 months ago, when I had the pleasure of meeting you and interviewing you, we talked about porcine circovirus type 3, and at the time, you were about the only practitioner in the industry, I think, that had knowingly had any hands-on experience with this virus. 18 months later, I'm assuming you've got much more.
Well, yes. Fortunately or unfortunately, I continue to see the virus and continue to work with the virus and try to learn about the virus in the field and the herds that I work with. And now we're learning more about the virus because there are people a lot smarter than me at the universities, Dr. Rivera, Dr. Bailey-Arruda, and others that are doing some really wonderful work in the laboratory to try to help us understand the virus itself. And then I've been working and had some really great summer student interns that have helped me in the field try to learn more about PCV3 and what it's doing in our herds today. And I presented that here at the Layman Conference.
And what I've heard is that there's no question about whether the virus is there. In fact, apparently it's quite common. But there is a question about whether or not the virus causes disease. What's been your experience?
That's a very common question, and it's something that I mention every time I present or we talk. Finding the virus does not necessarily mean you have disease. There's been a lot of work, and my summer student Abby Vinicoter presented on monitoring for PCV3 and processing fluids. Very great sample to monitor for sow farm status. But finding it by a PCR does not necessarily mean that it's contributing to disease. I believe it's underlying and that there's potential for it to cause disease, but I still caution and urge people that you've got to take the clinical picture in context with a positive PCR result. I very much believe that when PCV3 is detected and lesions are present, histopathological lesions consistent with circovirus infection, or PDNS, or post-weaning multisystemic wasting syndrome, when those clinical impacts and histological impacts are present in the absence of PCV2, but PCV3 is positive, in my mind, PCV3 is absolutely a pathogen. But again, I'll go back to, you've got to be careful and not make a diagnosis just on PCR alone, because there is a clinical component, and we've got to be cognizant of that as practitioners.
Well, disease or no disease, you've experienced losses. What specifically have you seen?
So what I tend to see, and it's very different from farm to farm, there's a lot of variability, and when you look in the literature, the research, and the reports from the diagnostic labs, they also will show a bit of variability from farm to farm and system to system. So having a true case definition is becoming a bit challenging for us in the industry, but on a sow farm level, fairly consistently, I will see inconsistent farrowing performance, primarily focused on mummified fetuses and stillborns. And when we look at mummies, upticks, extreme increases in mummy rates are generally associated with individual sows that will have large numbers of mummies, 3, 4, 5. Clinically, those present very much like porcine parvovirus or PCV2, in that you've got fetal death that occurs at multiple stages during gestation. So you end up with mummified fetuses that are varied crown to rump lengths as that fetal death occurs at different times. So that's one of the hallmarks that I see with PCV3.
But how do you know that it is PCV3? Because again, you know, you can have the mummies, you can have all sorts of problems that make you believe it's PCV3. You can run a test and discover that they do indeed have PCV3, but might it be something else?
It could, it always can, and that's why I caution people we've got to consider it in context with other diseases such as PRRS, PCV2, porcine parvovirus. You've always got to consider those potential other diseases on your differential list. Dr. Bailey-Arruda presented yesterday some really good thoughts about what tissues to collect and how many to submit. And one of the things she said was, when we're looking for this virus, we really need to target those sows that I mentioned that have large numbers of mummies in a litter And we need to submit multiple mummies from those litters because it is difficult. It's rare even to find the lesions in these fetuses. But when you do, you know that it's there. It's also rare to find PERS and PERS lesions in fetuses as well. So I'll make that caveat. But looking at those mummies, multiple submissions, multiple mummies submitted from multiple sows in that presentation is really how I chase that virus on a sow farm. Now I utilize processing fluids, aggregate processing fluids to monitor sow farms. I have a fairly good feel the lower the CT gets. If we get CT levels lower than 25, I have a fair bit of confidence that I need to go chase those mummies and prove that it's there. Because at that point in my mind, I think we really have some viral involvement when that CT gets low. And so that's how I approach it as a practitioner, and then start investigating. Do I have downstream performance issues? Do I have production? Is the farm reaching its true potential? And if that answer is no, have we been able to figure out why? Have we been able to rule out other causes? PERS, I think, is an important cofactor for PCV3. So oftentimes when I see PCV3, clinical PCV3 at sow farms, those farms are endemically infected with PERS and shed PERS from time to time. So those are all things that you've got to look at in context with this virus and this disease.
And what have you seen downstream?
Downstream, again, it can be somewhat variable. I tend to see pigs that just don't look good. They don't perform the way they should. It's hard to measure, it's hard to document. And I mentioned in my talk yesterday, proving disease can be very hard with this virus because there's so many other factors, so many production factors, so many individual pig factors. But downstream, you can see ill thrift, wasting, pigs that just don't start on feed, pigs that hang their head when they go to the nursery and just never look good.
But again, is some of that circumstantial? Could it be something else,
it
or
could.
we don't know?
Absolutely, absolutely it could, and that's what makes this so challenging. That's why you really have to put in some diagnostic effort to prove this disease.
And you've talked about different testing methods. Which ones have you found to be the most effective for PCV3?
It depends on what my goal is. Again, processing fluids are an excellent way to measure sow farm status. Again, you got to use a little bit of context there and don't make a diagnosis based solely on processing fluids. So I use processing fluids a lot in monitoring. Sow blood has not historically for me been a great sample. However, if I'm investigating sow mortality, tissue samples, kidneys, spleen, lymph nodes, those type samples, I always submit if I'm suspecting PCV3 as a cause for that, and skin, especially if there are skin lesions. Mummified fetuses, I can't stress that enough. Mummified fetuses is really what I chase.
You talked earlier about PERS. Where there's PCV3, there's almost always PERS. What other patterns have you seen?
I don't know that you can say that.
Yeah.
In my world and the herds that I work with, I'm in a very PERS endemic area. So I do believe PERS is an important cofactor for PCV3, but I will note that I have often seen PCV3 as a sole agent, and the diagnostic labs are reporting that as well. There are important cofactors, and that was presented yesterday, the diagnostic lab reports from the University of Minnesota and Iowa State Veterinary Diagnostic Lab. They showed the cases of abortions and stillborns and mummies where they measured other pathogens such as PERS and parvovirus. But they do show that PCV3 as a sole agent is not extremely common. It's a low percentage of herds, but it does exist. And those are the cases where I think hands down it's easier to make a diagnosis because that's the only pathogen there.
I've heard some of the university veterinarians say, yeah, PCV3 is out there, but it's similar to PCV2 in name only. They're completely different viruses. What has been your experience?
I agree. I agree with that statement. They are certainly completely different viruses. They're still both circular DNA viruses, but when you look at them on a phylogenetic tree, they're very different. They're very distant. And I still think we can extrapolate from PCV2 somewhat, but as we learn more about PCV3, I think we're finding that it's a bit of its own virus. Some things are similar, but it is causing disease in different ways, and we still need to look into that further.
And what are you finding these days with PCV2? I mean, 20 years ago, it was a really big deal in the pork industry. We did a great job of getting it under control with vaccination, but I've heard some reports of people having some breaks with it.
Oh, sure. It's still out there. It's still out there. It's not going to go away. We still find it. We still find it consistently, and also I find it in conjunction with PCV3 as well. So again, that's another diagnostic component that you've got to look at in context. I question if there's some sort of synergy between the two viruses. And it's just an anecdotal clinical observation, but I wonder if somehow there is some sort of relationship between PCV2 and PCV3 that adds to that clinical disease aspect.
Thank you again so much for sharing your insights on PCV3. I have a feeling we're going to have a follow-up conversation, or at least I hope we do in the very near future.
I hope so too. It's been a pleasure.
We've been talking to Emily Byers. She's a swine veterinarian at Prestage Farms in North Carolina. Thanks again, Emily.
Absolutely.